Dr. Douglas Robinson, Campbell Podiatry. We're going to talk about how to take care of a lesser toe ingrown toenail. An ingrown nail is where the nail, instead of ending flat, is curving on the side, and it causes swelling and pain, and if it's not addressed, it'll eventually become infected. So the edge of the nail, instead of ending right here, it's excessively wide, so the nail plate on the nail bed is causing swelling in this area. So this is an ingrown nail here. So this person has this ongoing ingrown nail right on the inside of the third toe. The big toe is number 1. The baby toe that went to market is 5. So this is the third toe, medial nail margin, and this is the edge that we're going to take care of right here. So we're going to remove this edge of the nail straight back because it's ingrown. This is called onychophosis. There's callus tissue here. This is ingrown, painful, but it's not infected. This is called a tourniquet, and this is like a rubber band around the toe to prevent there from being blood in the area. If there's blood, then the chemical that I'm going to use called carbolic acid will not do the cauterization of the root. This is called a partial matricectomy. I'm just going to release the fold of the nail relative to the skin. There's no cutting of anything. There's no stitches that will be required. And this has been anesthetized, so this person will have no pain whatsoever. So just pulling this away here. And this is what was ingrown there. So it's a little more than a 1/16 of an inch, less than an 1/8 of an inch. That was pinching on the side there. This is just dead skin from that nail rubbing against her skin. So the shearing forces cause it to be calloused, and it's a pain generator. This typically provides immediate, sustained pain relief. And I'm just putting this ointment in here to protect the skin when I use the chemical. If it was to get on her skin, it'll protect it so it doesn't burn her skin. And this person is on anticoagulant therapy, so there might be a little bit more blood there than what the norm is. We try to get this as dry as we can so it doesn't dilute the effect of the chemical that I'm going to use to cauterize the root. The root of the nail is called the matrix, and this is a selective treatment on just the corner. We call it a partial matricectomy. See, it's getting drier. Drier. And the nice thing is, if it's not completely dry, when I put the phenol in, that will help to dry it as well. And this is the phenol. It's also known as carbolic acid. And now there's almost no blood at all. More carbolic acid. No pain whatsoever. The only thing that's uncomfortable with this is just getting the anesthetic put in, and that's usually about 20 seconds. The care for this afterwards is for 10 minutes once a day, soaking the foot up above the ankle with Epsom salts, and then drying it, putting an antibiotic on there and a Band-Aid. Usually it takes about 4 weeks for these to be fully healed. I prefer people not to do any sport activities for at least 3 days. So we've done several applications of the phenol. So the cauterization is complete. Now we just dilute that with the alcohol. And now she's ready for a dressing. So here's antibiotic ointment. And we'll just put a nice dressing on here. Totally, totally comfortable. And that's how we take care of a painful ingrown toenail so that this person can have a happy, happy toe. I'm Dr. Douglas Robinson. This is how we take care of a painful third ingrown toenail. Please take care of yourself and each other.